Peggy Jones is feeling much better these days. Thanks to her experience at the Detroit Medical Center, she is able to enjoy a normal diet and a much better quality of life. Peggy suffered a serious gastric disease that plagued her on a daily basis, making her life miserable at times.
I think it's a gradual thing. You start realizing that you can't lay down without coughing or choking, you know. But I've been propped with pillows for a year, year and a half, 2 years. But the pressure sometimes is so extreme, I'm miserable. Yeah. And I just want to hold my belly to brace it down because it just hurt.
Peggy suffered from gastroesophageal reflux disease, or GERD, simple heartburn, which affects over half our population to one degree or another. GERD, or acid reflux, occurs when the valve separating the esophagus and the stomach does not close properly, allowing acid to back up into the esophagus. Current data reveals that GERD is increasing at an astounding rate. The number of patients hospitalized with a GERD-related diagnosis has jumped from just under 1 million 12 years ago to well over 3 million hospitalizations a year. So, Peggy Jones came to the DMC, where she met bariatric general surgeon Dr. Ali El-Hor.
Abdominal pain, epigastric pain, nausea, vomiting, atypical symptoms of chest pain, that acid taste in the mouth, nosebleed, asthma, wheezing. All these symptoms are contributed to the malfunction of the valve that is supposed to prevent the reflux of acid from the stomach upwards.
Although a minimally invasive laparoscopic procedure is offered at the DMC, technology now allows for a new, non-invasive method of treatment called the esophax. It allows Dr. El-Hor to repair the valve with absolutely no cutting.
The instrument, the upper GI scope, will direct us into the stomach, and with the retroflexion, we will be able to see and direct the instrument in a way that it will do the plication. So this case is a go. We're going to get ready now to pull the scope out and insert the device onto the scope.
That is the Nissen fundoplication. A fundoplication involves wrapping the stomach around the esophagus to create a functional valve that traps food in the stomach for digestion. With the esophax procedure, Dr. El-Hor is able to place sutures to attach the stomach to the esophagus.
So what we did is we raised a flap now from one angle of the non-functional valve, and now we're ready to fire our sutures to keep the flap intact the way we want it.
And so, in less than an hour, the condition that caused choking in her sleep, intense stomach pain, and bloating is corrected. And so, the patient should go home in about 24 hours. She should get back to her normal routine and back to work almost immediately because there was no incision. She will have certain dietary restrictions for 2 to 4 weeks, and other than that, she'll be fine.
I would say like about 10 days to 2 weeks after my surgery, I started feeling really good. I used to always have to sleep on my sides because I actually would choke. And through the night, I don't choke anymore. And I don't have the fear of choking anymore. So that was awesome, you know.
What was your recovery like?
Awesome without having stitches. That was the best part of that. I didn't feel a lot of pain inside either. I took nothing for medication once I left the hospital.
If you'd like more information on this surgery, or if you'd like to make an appointment with Dr. Ali El-Hor, visit dmc.org or call 888-DMC-2500. I'm Emery King.